What is hair loss? A healthy scalp has an average of 100,000 hairs, and an average of 100 to 150 hairs per day is considered normal due to washing and combing in adults. Hair loss, hormonal and nutritional factors can occur due to exposure to chemicals, genetic predisposition, systemic diseases, hair development disorders, drugs, psychological stress and scalp diseases. Hair loss in a healthy person can take up to 2 months. The hair loss period, which is repeated 3 times a year, exceeds 2 months, may be a precursor of some serious diseases and may require expert assistance. Hair loss usually starts 3 to 4 months after the triggering factor, and these factors can return to normal 6 to 12 months after treatment. The life expectancy of each hair is roughly divided into 3. Growth phase is the longest. The hair grows on average 1 centimeter per month. The hair that completes this phase then enters the resting phase, which takes several weeks. After this phase, which takes 2 to 3 weeks on average, it will enter the hair loss phase. The hair that enters the hair loss phase loses its connection with the hair follicle and falls out within 2 to 4 months. This period can be shortened even more by combing, brushing and washing processes, but cannot be extended. At the end of this period, even if nothing is done to the hair will fall out by itself. New hair is produced from the hair follicle instead of the hair. This cycle continues for a lifetime. It cannot be understood at what stage the hair is from its outer appearance, and 85 to 90% of the hair will be in the growth phase, 1 to 2% in the rest phase and 10 to 15% in the shedding phase in any time period. The logic of accepting normal hair loss up to 100 hair on days without bathing comes forward in the physiology of the hair described above. Knowing these stages is also important for understanding why treatment lasts for hair loss. Hair loss causes. Every existing hair strand has a life cycle. Each strand lives 4 to 6 years, then rests and then falls out. Hair loss in this way is an extremely natural process, and 50 to 100 hair loss per day is considered normal. This should be taken seriously if there is more hair loss than this number, the amount of hair that has been obtained while taking a bath has increased, or if we have 3 to 5 hairs when we pull the washed dry hair by hand. There can be many different causes of hair loss. The important thing is to determine this cause and to make appropriate treatment. 1. Genetic factors. The reasons for hair loss in women and men are different. Hair loss in men is usually male-type hormone-sensitive hair loss, which is genetic and occurs in more than 50% of the society. This type of hair loss is chronic. As the age progresses, baldness develops and may require hair transplantation as a result. Reinforcement treatments started at an early age, mesotherapy and PRP treatments slow down the spillage rate. It prolongs the time to go baldness. This type of spillage is also seen in women. Especially people with individuals with baldness problems in their families face the risk of hair loss. Today, male pattern hair loss, which is between the ages of 16 to 18, is seen more frequently in young girls. The reasons why this situation is encountered more frequently compared to previous years include excessive stress, unbalanced diet, long-term fasting and hormonal problems. Success rate can be increased with the addition of hormonal treatments in addition to treatment like in men. 2. Skin problems. Skin and internal diseases can also cause hair loss. Most skin rashes occur when diseases involving the skin affect the scalp. If hair is affected in conditions such as psoriasis, eczema, acne, lichen disease, excessively oily skin, fungal diseases, hair loss may be inevitable. The treatment of these spills is possible with the treatment of the underlying skin disease. 3. Wrong eating habits. Hair loss due to nutritional causes is another common factor. After all, the hair is a living organ and its nutrition needs to be bleeding. Not eating a regular and balanced diet, long-term hunger, uniform nutrition and consuming foods with a high carbohydrate content can ultimately affect and shed hair. Its treatment is extremely practical and it is important to start a balanced diet. 4. Vitamin and mineral deficiency. Although there is no nutritional problem, the deficiency of vitamins and minerates required for hair is another reason that sheds hair. If vitamins and minerals such as B12, vitamin D, folic acid, biotin, zinc, iron are low, the hair cannot be fed and shed. Even when there is no iron deficiency, iron supplement reduces hair loss. In these cases, the supplement must be removed by contacting a specialist. 5. Hormonal problems. If the person has hormonal problems, menstrual delays or irregularities, increased hairiness, excessive acne, and acceleration in weight gain, then hormonal hair loss can be mentioned if hair loss is added to these findings. Dermatology specialists should be consulted to determine the source of these problems, with a blood test to be made on the second or third day of menstruation. Hormonal treatments are effective in this type of spills. 6. Some internal diseases and drug use. Some internal diseases, diseases of the thyroid gland or drugs used for these diseases, rheumatic diseases, hormones used, slimming pills, adrenal gland diseases, insulin resistance, diabetes, birth control pills, and sometimes these control pills are other causes of hair loss. This situation must be thoroughly investigated by examinations to be performed by specialist doctors. If a sudden hair loss has started, surgeries, febrile illnesses, drug toxicities, blood loss, and severe trauma may have been considered. 7. Delivery and chemotherapy process. Apart from all these, there are 2 specific causes of hair loss. One is a postpartum spill that starts 2 to 3 months after birth. It is caused by the sudden shedding of hair that should be shed during pregnancy but not shed altogether. Supplements to be made under expert control contribute to the elimination of discomfort in this regard. Another is hair loss in patients receiving chemotherapy. These spills are less common with the use of more modern medicines in recent years, but are already prone to self-recovery when treatment is completed. 8. Cosmetic factors. Increasing cosmetic habits are other factors that cause mechanical, chemical, and physical hair loss. In other words, to tie the hair tightly, internal bones, blow-dry processes exposed to excessive heat, dyes used to lighten the hair, openers, straightening methods cause hair loss by damaging the hair from the outside. In this case, the only treatment is to prevent the hair from being exposed to these applications. Applying the necessary reinforcement and care processes for the hair provides the desired appearance. Stress and depression. Excessive stress is another cause for hair loss as well as any disease. Depression, anxiety, psychosis, and medicines used to treat them can affect hair loss. Hair is a living organ that can be affected by many factors in a short time in daily life. In the light of this information, the individual should first weigh himself and then seek help from a dermatologist if necessary, if something is wrong with the person's life. Because misleading and hearsay information from the environment can cause patients to lose time. If there is an important underlying cause, it may be delayed in diagnosis and treatment. Apart from this, unconsciously applied masks and mixes with the idea of preventing hair loss and re-losing the hair can cause irreversible damage by causing more damage to the hair.